Our next speaker in this panel is Patricia Mabry, who's going to be speaking of systems approaches.
Okay, hello everyone. Good afternoon. Nice to see some familiar faces and some that I don't know. So nice to meet you all. I'm going to be talking about system science approaches. So the first thing to know about me is I'm not any kind of dietary expert. You'll probably discover that quickly. And I believe I was brought here not for that, luckily, but for my experience, I would say, with system science. I was at NIH for many years and developed a system science program there, although I am not myself trained as a modeler, not formally anyway. I'm trained as a clinical psychologist. But I've gained some insight by managing some programs where other people did a lot of modeling, and so I'm hoping to share my insights here with you. So the task I was given is how can system science approaches improve the synthesis, analysis, and interpretation of available evidence? So I'm going to do these things listed below, trying to focus on synthesis, analysis, and interpretation of available evidence, weaving in a little commentary about what I've seen from other folks today. Before I get started, though, I want to let you know that I think you all should read this. You probably have, but I had not before this assignment. And this is one of the 2015 DGAC committee members was Frank Hu, so that's why I thought maybe you all had seen it. It was from 2015. My main takeaways from this article were that RCTs are not feasible or appropriate for a lot of the nutrition epidemiology studies because the phenomenon under study are too complex. That's where the system science methods will come in, you'll find. And there's blinding problems and compliance problems. There's a lot of reasons that we should use a diversity of approaches, so not just relying on RCT. So that's something to keep in mind when trying to weight the evidence from the studies that are generated. It may not always be appropriate to use that. It might be appropriate for an intervention study, but not for necessarily other kinds of studies. And we can use convergence from different types of studies to infer causality. Just a comment from what I heard this morning was one of the review approaches, I don't remember if it was HRQ or NREL, said they used study design to restrict which studies would be selected. And that may very well be a good idea, but just be aware of the other unintended effects. You may be missing some of the system science approaches that might be there, for example. Regarding meta-analysis and systematic reviews, also be aware of publication bias. So there may be things that aren't in a systematic review that may be appropriate. So for example, the journals that are being pulled from, that's another bias, I would say, the databases from the literature. So consider using some broader databases like Web of Science that covers more literatures than just those in like PubMed. And I know there were more than just PubMed. I'm just saying think about whether they include everything. And also we need some, this article talked about needing studies over the entire life course, that was mentioned, and of longer duration. I can see by my time I'm not going to get nearly through all of this, but just want it to be here for your reference, and I'm happy to talk to you about any of it in the future. This is from the article, and it just shows this whole idea of the exposome and the physiome and the phenome, basically that we need to look at all of these inputs together. That's the whole idea behind system science and why it can be so useful, is because it does address the complexity. So rather than trying to have two groups that are equivalent on everything except, one thing that you're of interest, you do want to look at the complexity and the differences across everyone and embrace those. This is just another way of expressing that same idea, that there's things that are under the skin, outside the skin, and that occur over time that we're trying to capture. So some general characteristics of system science methodologies are that they do try to capture dynamic behavior change over time, bidirectional relationship, so not just A influences B, or the diet influences body weight, but maybe body weight influences the diet. These kind of feedback loops. Nonlinearities, so things may need to reach a certain threshold before you see an effect. So for example, maybe your cholesterol level can go up and up and up without seeming to affect you until one day it clogs your arteries, right? That's a threshold phenomenon. Or worse before better. Some policies might make things look like they're getting worse before they actually improve the outcome of interest, and there can be time-delayed effects. These are all the things that these methods are designed to capture. The previous speaker mentioned unintended consequences, and so I think what you're doing there, Patricia, did you go at Patricia or Patty? I'm not sure where you are, but oh, there you are. Those are, you're doing exactly the same type of things we're doing. You're just doing it in a different kind of a way. Let's see, there's emergent properties. So individual behavior leads to aggregate outcomes. Think of something like a traffic jam. If you just study, this was talked about the reductionist approach, right? So if you just study a car, you're never going to understand a traffic jam. You have to study the totality of the cars. Or a rainstorm, you can't just study a drop of rain, you have to study all the raindrops together. These are the kind of phenomena that only come out when you have the aggregate. One of the very important things I think that system science can do for this committee is to help identify gaps in the existing knowledge and use sensitivity analysis to tell how important they are. We can do the virtual experimentation, which is what Patricia Britton was doing in these in silico laboratories, right? And so this may not be, you can use synthetic data, you can use assumptions. They're not wrong, they're just laid out for you a priori what those assumptions are. It's not that you're violating statistical assumptions, it's that you're stating what they are and showing what would happen under those conditions. There's a lot more slides here than you can be able to have at once. These are really just all talking about the different ways that you can have complexity in the diet. I think people already talked about them, differences between the people, the food elements that they're ingesting, the contextual factors of, say, for example, the food, like is it a pasture-raised organic cow with non-homogenized milk coming out of it, right? Or are you having like some dairy substitute kind of thing, like non-fat dried milk like I was raised on, yuck. Timing and frequency and duration and more contextual factors. And so the idea is really just to show you how quickly these complexities add up. And the idea behind modeling is you want to simplify that complexity to the point where it's tractable and informative. You retain the salient pieces so you can understand it better, but you're never going to get to the complexity of the real world, and if you get to that point, you have the same problems that you have with the real world, which is it's very difficult to understand. But that doesn't mean we shouldn't do it at all and that we should just rely on our reductionist techniques, although I would say I am in favor of those. Let's not say that they should get lost. They should be included in a family of methods that we use to explore and come up with DGAs. I just include here some literature on complexity of even just the microbiome, factors contributing to the development of the microbiome, including things like birth and perinatal colonization, familial exposure. So it's not just what you eat that affects the microbiome, it's all these other things. And I guess I would argue, just think about whether or not diet should be looked at exclusively and whether or not the real question should be looking at the diet with all the other factors that come to affect the health. And I think this was what Dr. Garza, is that the correct name, was saying about looking at the chronic disease as the outcome and then all the inputs that go into it, including diet. Because if you pull it out by itself, that's like excluding that raindrop from the storm, or it's like pulling out the tire from the car and just studying the tire, right? So models are inexact representations of the real thing. So back here, this is a pipe, and a picture of a pipe, I should say. And in French, it says, "Ceci n'est pas un pipe." I think that's my French from 8th grade. This is not a pipe. Well, it's not a pipe because it's a picture of a pipe, right? So you can't smoke out of that pipe, right? Let's not smoke in here. I'm a tobacco control person, too. But the idea is that that's a picture of a woman, it's not a real woman. And the same thing, you cannot expect your model to be a real thing. It's an imitation of a real thing to give you better understanding. And Patty, you referred to the weather storms, and that's exactly the idea. And I believe something playing off of what Dr. Garza said, it was about the personalized or precision medicine. I think we will get there, and I think the technology is going to help us. I think that there are going to be ways to deliver the interventions to whether it's smartphone or Fitbit or some other technology, and then feed that data that you get from that person back. And maybe not even the data, because that's the privacy issue, but maybe the results of how well they did. So maybe there's a computation that happens on their phone and feeds back. There's a guy at University of Virginia, a former classmate of mine, Steve Boker, working on this type of thing for how to get away from the privacy problems. Now, his specialty is quantitative methods. So he might be a real good guy to partner with some folks who are experts in dietary intervention and try to help come up with some of these solutions. I think one of the things that may be missing, one of the things that was mentioned in the charge was considering the makeup and the viewpoints of the people that are on the committee. And I would take that to mean include people like the folks from modeling and simulation or like Steve Boker at UVA that can help us think through these things, not to come up with viewpoints that are different from what science is telling us, like not believing in climate change. We definitely need some non-believers in the room, or we definitely need the people who don't, I'm trying to say this is not what we want, embrace the skeptics that tobacco is bad for us, because look at, that's the public health disaster that we had from the past century, was that we overlooked the seriousness of tobacco control, tobacco smoking, I should say, because we had the tobacco lobby getting in the way. So when we think about the viewpoints, let's be inclusive for people from other branches of science, but let's not be inclusive of people who may have an axe to grind. At least that's my opinion, if it's going to go against the grain of public health. Okay. And you can, all models are wrong, some are useful. Okay, there's a spectrum, right? Okay. So I just want to quickly give you an example from PRISM, because I think it'll help illustrate one of the uses. And I don't know if you can see this too well. This is from CDC, did a ton of work and spent a lot of money developing. This is system dynamics modeling. So one of the things about system science is that it includes a number of different approaches. I was going to try to illustrate for you system dynamics modeling, agent-based modeling, and network science all in this talk. It probably won't happen. But this one can be used for this idea of identifying where the gaps are and prioritizing the evidence. So in this case, I think what's useful is looking at the outcomes here are in red. So deaths, deaths that are not attributable to cardiovascular disease, those that are cardiovascular events, and then cardiovascular disease deaths, and then total costs attributable. That's all the stuff in the red. And that's kind of like modeling, chronic disease outcomes. Maybe it's going to be diabetes and obesity and health and cost or something like that. But you got to come down to some lower number. I think what you may be in danger of doing, the DGA as it's grown over time, maybe trying to do more than it can reasonably do. In other words, you're really stretching thin on what those guidelines can do, and that's why I think I embrace that idea of maybe kind of personalizing it to some extent. And I know that some of the guidelines had tailored for different populations. I think that was in the, maybe that was 2010 or maybe 2015 or both. But as you see here, these are all in green, the proximal causes. So what you do is you mine the literature, and this is where those systematic reviews can come in, although that may not be everything that you want to rely on as the systematic reviews, the meta-analysis, and maybe a little bit broader capturing of what goes into the model. And these are things, in this case, when you're looking at cardiovascular disease, things like air pollution, secondhand smoke, smoking, obesity, junk food in the diet, fruit and vegetable intake, sodium consumption, physical inactivity, and so on. And those things go into affect the chronic disorders like hypertension, high cholesterol, diabetes, and then they can lead to an uncontrolled condition, which can then lead into a cardiovascular event. And so the whole idea is that this is just the schematic, I think kind of like what Patty was saying in her talk. And what they do, the system dynamics modelers, and you would want to get expert team who does this, once you get the literature, they can put in the equations, differential equations that map these so that they can show these synergistic and multiple effects of these components as they relate to each other. And then what you get is the policies that go on top of that. In this case, those could be the guidelines that go on top of that and see which multiple proximal factors, they each affect. So you've got tobacco interventions would affect both smoking and secondhand smoking. And you see that secondhand smoke contributes to cardiovascular events, but also smoking itself does. So both of those contribute. Junk food would affect excess junk food in the diet. Junk food interventions, I should say, like taxes, would affect not only excess junk food in the diet, but also fruit and vegetable intake if there's substitution. And so on. And you do this and you map this all out with all these, the literature informing all of those differential equations. And then what you can do is come up with the outcomes at different time steps. And each time step depends on the previous time step, which is the accumulation of these factors over time, which is one of the advantages of this type of method. And that's what Dr. Garza was talking about in terms of your history of what you've done up to this point will be carried with you to the next time step, right? I realize we need to move on, but this just shows you how the outcomes for the different that you care about would be impacted by different interventions, and you can combine the interventions to see what impact you would get. I know that I'm out of time. I'm surprised I went to 30 minutes already. I think maybe I misunderstood my time I had. So these are more examples. There's some from network science that are interesting in here. Data mining, cognitive computing, all of this stuff fits very well under the rubric of system science methods. I think I wanted to give you a little bit of advice here. Identify these clear research questions. Again, if you make your scope too broad, your guidelines won't be able to do everything they're supposed to do. Stay true to public health. Don't give in to, like they did for the tobacco industry or the whatever it is, meat industry, dairy industry, junk food industry. I think a big thing I've seen is not partnering, and I had an example, I didn't put it in here, but there's a team, there must have been 12 computer scientists, network scientists, data mining people. Do you think they had a single person with public health or dietary or nutrition science at all? No, but they got all these great techniques, they got all these tools and widgets and great stuff. You've got to pair with them, okay, so you all can know about each other's stuff. Let's see, this is a lot of rehash. I think there should be some way to leverage big data. There's so much data out there. I think these kind of techniques are really useful at doing that. They don't substitute for selecting your representative population, but if you have existing data, there may be ways to use it. I talked about that one already. This is some reading for you. I have a reference list as well, so I'll leave it at that.
Thank you very much.